What kind of symptoms are referred to as dementia? By 2025, it is said that 1 in 5 people over the age of 60 will have dementia. People with dementia do not forget everything indiscriminately. I want everyone who may be involved with dementia to know this. Dementia is an illness that, if managed properly through certain interactions, can allow the person to live a lively and energetic life. I would like to explain these things from a doctor's perspective. Thank you for watching the video. This is YouTube Medical University, presenting a comprehensive video covering all aspects of dementia. In 2025, it is said that 1 in 5 people over the age of 60 will have dementia. In other words, 20%. Many people are worried that if they can't prevent dementia or miss the early symptoms, it will progress further and they won't be able to live their lives as themselves. So this time, we'll talk about what kind of illness dementia is, what the early symptoms are there any signs, and is it really possible to prevent dementia, and it's about the treatment methods for dementia. What are the latest treatments available now? And finally, I want everyone who may be involved with dementia to know about this. Dementia is actually this kind of illness. If you interact with people this way, they can live lively and energetic lives. I would like to explain these things from a doctor's perspective. I work in community healthcare at a general hospital in Hokkaido. I provide home visits, inpatient care and outpatient care. While diagnosing and treating dementia, I also give lectures and guidance on care. Today's video is a bit long, but I've packed it with really important things I want to share, so I'd be happy if you could watch until the end. And if this video is even a little helpful, it will motivate me to make the next one. I'd really appreciate it if you could subscribe to the channel. It would motivate me. At YouTube Medical University, I share information from a doctor's perspective about early detection of diseases and preventive knowledge. In hospitals, due to their structure, medical fees are generated by diagnosing and treating illnesses. Spreading knowledge about illness prevention doesn't benefit hospitals much. However, early detection and prevention are also important, not just treatment. In other words, stopping diseases before they develop. That's why I'm sharing these videos, to convey this message. Let's learn together. Today's agenda. First, a simple explanation of dementia, and next, what are the early symptoms of dementia and how can you easily screen for dementia? I'll introduce some tests. And in the 4th section, what exactly is dementia? Are there any treatment methods? And in the 5th section, what can you do to prevent dementia? I will discuss mild cognitive impairment, the precursor to dementia, and introduce the sole diet proven to prevent dementia. And in the 6th section, I will talk about not only how to prevent dementia, but also how to live a vibrant life even if you develop dementia. I will also share my thoughts on how society, not just individuals, needs to change. Finally, in the 7th section, for everyone involved with dementia, I will explain what kind of illness dementia is and how to provide care. Even if someone has dementia, they can still live happily as themselves. That kind of important. I would like to introduce 3 important principles of care. In the first part, I will explain what dementia is. First, please look at this graph. This shows the percentage of people with dementia by age group. Please look at the number in the middle. There are numbers that jump up to 22%, 41% and then 61%. These are actually the percentages of people with dementia. In the early 80s it's 20%, in the late 80s it's double that at 40%, and it's said that in their 90s 60% of people have dementia. It's said that over 50% of people in their 90s have dementia. I think I'll never get it, or something like that. Even those who are confident, the risk of developing dementia increases as you get older. What kind of symptoms does dementia refer to? When you learn about it again, you realize, so that's what it was. When people think of dementia, they think of forgetting things. In the past it was also called senility, and I think some people remember it in that general way, but that's actually incorrect. People with dementia don't forget everything. There are 3 main types of impairments in dementia, so let's look at them one by one. The first is memory impairment, the second is disorientation, and the third is impairment of understanding and judgment. There are some difficult kanji here, but don't worry, it's simple. So what is the first one? Memory impairment. Memory isn't just about remembering things. It can be divided into 3 stages. The ability to remember new things, and then being able to the ability to retain information over time, and furthermore, the ability to recall what you've remembered, to pull it out from the drawers in your brain. These can be divided into 3 stages. For people with dementia, only one of these is impaired. So, among remembering, retaining, and recalling, which one is affected? It's the first one, remembering. They have difficulty remembering new things. On the other hand, things that are not new, things they learned long ago, they can still retain and recall. Haven't you experienced something like this yourself? Even people with dementia can have completely normal conversations, and when they talk about the past, they can speak so enjoyably that you wouldn't even notice they have dementia. This is because dementia doesn't make you forget everything. They can't recall new things, but they enjoy discussing the past. Remember this. The second one is called disorientation. It's a simple concept despite its complicated name. Memory related to people, places and time tends to decline. Things that change a lot are gradually forgotten more easily. In other words, since time is constantly changing, as dementia progresses, it becomes harder to know the date, season, or recognize places, even recently visited ones. When staying somewhere overnight, you might get lost or not know where you are. It becomes difficult to remember people, even close family members you haven't seen recently. Eventually, you might forget your primary caregiver who is always by your side. These kinds of things can happen with advancing dementia. One of the changes that often happens in the early stages of dementia is that people may not be able to choose clothes that match the season. They may wear a warm sweater in summer or go out in thin clothing in winter, looking very cold. Such things can happen. These kinds of symptoms might be due to something called disorientation. The third one is called impairment of understanding and judgment. The most common type is Alzheimer's disease. In Alzheimer's type dementia, the hippocampus, which controls memory, is affected, but also the parietal lobe. This area is responsible for spatial memory, memory of places, and the ability to judge and understand things. As these functions become impaired, people gradually lose the ability to perform slightly more complex tasks in their daily lives. For example, cooking. It's actually a pretty complex process, isn't it? You have to take out the ingredients, cut them, wash things in between, and cook at the same time. Then you season the food, plate it, and serve it. Handling this series of tasks becomes difficult, so one of the early signs of dementia is that the variety of dishes someone can cook decreases. The flavors have become monotonous. Changes like this could be a sign of dementia. It's not just that. Using household appliances like kettles or rice cookers can become confusing. And then there's the checkout process when shopping. Nowadays, there are self-checkout registers, but some people can't use them. Also, things like buying tickets from a subway ticket machine. These kinds of complex daily activities become difficult. This could also be due to impaired understanding and judgment caused by dementia, possibly affecting the parietal lobe. When I see patients in my clinic, they sometimes ask me, "Lately, I've been forgetting things more often. Doctor, could this be dementia?" When I'm asked this, I always answer, as long as you can ask me that question, you're fine. Why is that? It's because you are aware of your own forgetfulness. For example, when you say, "What was that thing called again?" and someone tells you, "Oh, it's this," you can respond, "Yes, that's it," and understand. In other words, you recognize that you forgot something. However, people with dementia can't remember things in the first place, so even if someone tells them, they can't recall it. That's because the memory is completely gone. Even if you say, "You ate fried shrimp yesterday, right?" they'll respond, "No, I didn't eat that." On the other hand, from their perspective, they might think, "My wife says I ate fried shrimp yesterday, but I didn't. Did she eat it secretly? Or maybe she's the one who's confused." They might even start to think that way. In other words, normal forgetfulness, everyone forgets things sometimes, is just a temporary inability to recall something. If someone reminds you, you remember and realize, "Oh, that's right." But with forgetfulness caused by dementia, the memory itself is completely gone. So even if someone tells you, it doesn't make sense to you at all. This means it's hard to even realize that you've forgotten something. For example, with normal forgetfulness, you might think, "I drank miso soup yesterday, but what was in it?" But for someone with dementia, the memory itself is missing. So they might say, "I didn't drink miso soup yesterday at all." Please understand that the memory itself can be completely lost. Now, in the second period, as I've just started to mention, what other early symptoms of dementia are there? I'd like to introduce 6 carefully selected examples. 6 early symptoms of dementia. The first one is this: repeating the same thing over and over. We often get consultations like this. For example, "Doctor, it's about my father. He asks the same question again after just hearing the answer, and he asks it about once every hour, so I get irritated answering him. Because I get irritated, he also gets irritated, and we're really having a hard time." However, from the perspective of someone with dementia, when they ask, "Hey, is breakfast ready yet?" Even if you say, "No, you just had breakfast," and they think, "Oh, is that so?" After an hour, they have no memory of eating breakfast or even asking the question, so they think, "Wait, come to think of it, I haven't had breakfast," and ask again, "Hey, is breakfast ready yet?" If you say, "You asked an hour ago, I told you that you just ate," from their perspective, they can't really know if that's true or not. For these reasons, repeating the same questions and such is an early symptom of dementia. I'll talk about how to respond when you're asked the same thing over and over like this in the care section of the 7th period. Here is the second of the 6 early symptoms of dementia. Forgetting where things are placed becomes more frequent, and they often end up looking for things. Actually, I also often lose things, but this is different from that level. It's about forgetting and searching for things many times a day. This can simply be because dementia makes it hard to remember, so things get lost. When someone develops dementia, they lose the memory of, "I put this here," so it's easy to lose things. When they find the lost item, they think, "I shouldn't lose things over something like this. I shouldn't trouble my family." Because of that, they end up putting things in places that only they understand, places they think are easy to remember. Because they hide things in secret places, it becomes increasingly difficult to find them, creating a vicious cycle. Soon they start thinking, "I thought I put it here, but it's gone," forgetting that they hid it themselves. They may start to think that someone took it. This is called paranoid delusion of theft. The name comes from the idea of imagining that things are being stolen. Personally, I don't like this term. The reason is, from their perspective, they tried to be careful and put things away, but because they forgot that they put them away and now can't find them, they end up thinking, "Someone must have taken it." Paranoid delusions of theft are a natural occurrence under certain circumstances. It's crucial for those around the individual to understand this. I'll discuss how to handle these delusions later on. 6 early symptoms of dementia. The third one is this: having trouble with cooking or shopping, which they used to be able to do before. As discussed earlier, dementia makes it challenging for individuals to understand and make decisions. Consequently, they gradually lose the ability to perform complex tasks like cooking and shopping. 6 early symptoms of dementia. The fourth one is this: their wallet gets stuffed with coins. Have you ever had your wallet stuffed with coins? It often happens to me when I travel abroad. The reason for this is, when you go overseas, it's hard to tell which coin is how many cents, or how many baht, or how many dollars, right? So you end up using bills more often, and the coins pile up. This is the same for people with dementia. When you're told at the register, "That'll be 512 yen, it gets harder to calculate, like 5 100 yen coins and 1 10 yen coin. But people with dementia still remember things from the past. They also have years of wisdom. When told, "That'll be 512 yen, they know handing over a 1000 yen bill makes the transaction go smoothly. Rather than struggling to count coins and feeling embarrassed, they realize it's easier to pay with a bill and get it over with. That's why they tend to use bills more often. Their wallets end up getting stuffed with coins, so if you notice that your family member's wallet is full of coins, it might be a sign of something. It could be a sign of dementia, an early symptom of dementia. The fifth of the 6 signs is losing motivation and not going out anymore. As dementia advances, you may begin to suspect something is amiss with you. Due to this sensation, you wish to avoid detection and burdening others, that sort of emotion, because of those feelings. It becomes harder to go out. After all, even if you do go out, things often don't go well, and the habits you used to have of going out start to fade, so gradually it becomes harder to leave the house because of things like this. As dementia progresses, opportunities to go out decrease. I'll talk about this more in the treatment section, but there is data showing that maintaining connections with various people by going out helps slow the progression of dementia. So if you stop going out, dementia progresses even further. And if you go out even less, it becomes a vicious cycle. That's why it's very important to stop this from happening. Maintaining connections with society is extremely important. 6 early symptoms of dementia. The sixth one is becoming easily angered or more suspicious. Please don't just simply remember that people with dementia become easily angered. It's important to think about the process of why this happens. When someone develops dementia, they start to worry about behaving properly and become more considerate of those around them. At the same time, anxiety grows inside them about whether their dementia might get worse. However, if the people around them don't understand and say things like, "Mom, I already told you had breakfast," or "Stop losing things all the time," that anxiety turns into frustration. My daughter's lack of understanding is frustrating, which can lead to anger. If understanding remains elusive from others, it can compound the issue. That frustration eventually turns into suspicion. They start to think, "This person is my enemy, they're trying to make me suffer, they're always being mean to me," and so on. Accumulated negative experiences can erode trust in others. Depending on the environment, it may be possible to address issues like anger or suspicion. However, the text is incomplete. Dementia, care and nursing are really difficult. Even when people are doing their best and being very compassionate, sometimes they just can't help but get angry or suspicious. So if you see these kinds of symptoms, please don't assume it's always because the support around them isn't good. There are many times when things just don't go well, and that's why there are specialized forms of care. So let's keep learning about this until the end. In the third period, we'll discuss how to determine if someone likely has dementia. I'll introduce screening tests. The first test is the finger movement test, which is simple. If you'd like to try it, let's do it together. Please imitate me. First, make an OK sign with both hands. Next, make a fox sign with both hands. Did you get it? Then, bring the fox signs together so the ears touch, but reverse the front and back. Finally, rotate your right hand 180 degrees and bring the fox ears together again. How did you do? If you can make the OK sign, make the fox. Reverse the ears, rotate your right hand and bring the ears together. Your risk of dementia is quite low. The reason for this is that with dementia, the part of the brain called the parietal lobe, which is responsible for spatial understanding, declines. That's why actions like reversing or rotating things, which require spatial awareness, become difficult. However, just because you couldn't do it doesn't necessarily mean you have dementia. Please keep that in mind. It's fine to try this yourself, but don't use this to check if your family members have dementia. If someone wants to try it on their own, that's fine, but making others do it without reason could hurt their self-esteem or even cause other problems. It could even damage your relationship with them, so please be careful about that. Instead, there's a simple and more detailed test called the mini-cog. There's a test for this. To take this test, you'll need paper and a pen, so I'd appreciate it if you could prepare those while you watch this video. So what kind of test is it actually? From now I will say 3 words. I'll ask you these words again later, so please remember them. Sakura, cat, train. Now for the next task, please draw a clock showing 11:10. The positions of the second hand and the hour hand. How does it look? If you're actually doing this, please pause the video and draw it. Now, for the final task, please recall the 3 keywords I asked you to remember at the beginning. If you can't answer all 3 of these final keywords, or if you couldn't draw the clock, and furthermore, if you could only answer 1 or 2 of the last questions, you may have a slightly higher risk of dementia. However, not being able to answer them does not necessarily mean you have dementia. If you were able to do this, your possibility of having dementia is lower, so I hope you understand that there are tests like this. Now in the 4th period, I will explain what kinds of treatments for dementia are currently being used and whether they are truly effective. I think there will be quite a few surprising points in this 4th period. These are treatments that are still commonly used in Japan. The medications for dementia are called cholinesterase inhibitors. Some examples of these drugs are Aricept, donepezil and rivastigmine. These are known as anti-dementia drugs. Many people believe that taking these medications for dementia will cure the condition or stop its progression, but that's actually not the case. The dementia medications currently in use are not particularly You can't expect much effect, and even if there is some, it's not something that a third party would notice as a significant improvement in cognitive function. You can expect much effect. In fact, because the effect is so low, in some countries like France, these medications aren't even covered by insurance, and that's understandable. In Alzheimer's type dementia, waste products like tau protein and amyloid beta accumulate inside brain cells. It's believed that the buildup of these substances is the cause, but this medication isn't designed to remove those substances. So, since it doesn't actually eliminate the cause, its effect isn't that significant. Please take a look at this graph. This is the general idea. If you don't take the medication, cognitive function generally declines like this over time. Now, if you do take the medication, the orange line shows that cognitive function may seem to improve slightly, but ultimately, it still declines at the same rate. The moment you take it, your cognitive function score goes up a little. The diagnostic score may improve with medication, but the change may not be noticeable to others. The decline in cognitive function slows down. I think you can understand that this is not necessarily the case. Furthermore, it's said that out of 10 people who take this medication, only about 1 person can expect such effects, and out of 12 people who take it, 1 person experiences side effects like nausea, diarrhea, or stomach pain. Many people also experience these side effects. Thus, if the medication is ineffective, discontinuing it should be considered. In my outpatient practice, having too many medications can be harmful. If a medication is ineffective, I sometimes have patients stop taking it. New medications for dementia have been recently adopted. There are various medications available, but even the latest ones currently on the market have not produced the remarkable results that were expected. So at present, both in Japan and around the world, for dementia, there is no medication that can be called a cure-all. Your understanding is correct, which might be surprising. However, developing dementia doesn't mean it's the end. Next, I'll explain what besides medication can be done to prevent dementia progression and the role of diet. Now, in the 5th period, I will introduce ways to prevent dementia and methods to slow its progression, including supplements that are said to be effective for dementia. There are a lot of functional foods out there, aren't there? However, there is no solid research showing that these products actually prevent dementia. The first one is vitamins, things like vitamin C and other vitamins. The second is beta-carotene. The third includes docosahexaenoic acid and eicosapentaenoic acid, known as APA. The fourth is frequently mentioned, ginkgo biloba extract. As for these, the current situation is that there is no solid data. However, just because there is no such data doesn't necessarily mean they have no effect. Some may have felt the effects of taking them. It likely depends on the individual, so if you believe in them, taking them should be fine. However, taking too much can be problematic. You need to be careful about side effects, and if you expect too much, you might end up feeling disappointed if it doesn't work. So I think it's fine to try it safely, just hoping it might help. But as I keep saying, please understand that there is no objective data. So on the other hand, what kinds of behaviors are associated with a lower risk of dementia? In other words, what are the things that are more likely to help prevent dementia? The first is talking with other people, the second is regular exercise, the third is a well-balanced diet, and the fourth is having a regular lifestyle. The fifth is quitting smoking. The sixth is limiting alcohol consumption. The seventh is properly controlling your blood sugar and blood pressure. The eighth is periodontal disease, improving it, and the ninth is improving hearing loss. That's it. What's your opinion on factors like diet, exercise, blood pressure, smoking, and alcohol? This text only contains things generally considered healthy, right? I think many people might be disappointed thinking, is that all? Even when you go to the hospital for an outpatient visit, the doctor tells you to exercise or to stop overeating. But I think many people feel that if it were that easy, they wouldn't have any trouble. What I want to emphasize here is that there isn't some specific substance you can take to prevent dementia, like that kind of thing. Be cautious of people who say extreme things. In fact, statements like that, if it existed, hospitals would prescribe it to everyone. It's crucial not to be misled by extreme information. Let's examine each point individually. I'll discuss conversations with others later. As for exercise, it's said that you should do moderate intensity aerobic exercise, enough to get a little out of breath, about 3 times a week, and for around 30 minutes each time. However, it's not so easy. Exercising 3 times a week for 30 minutes is tough. Even I can't do it that often. Start with a 10-minute walk once a week, 5 minutes out and 5 minutes back. That's enough to begin with. Each small step you take gradually builds up into a habit. And when it comes to exercise, data shows that walking 2,000 steps daily, 10 minutes each way, can lower the risk of clogged heart blood vessels. Don't set goals too high initially. Even 20 minutes of enjoyable activities or walking is fine. Keep this in mind and give exercise a try. I've explained specific amounts of exercise and recommended exercise methods in this video, so please check it out from the description below. And third, it's important to have a well-balanced diet. In fact, it can lower the risk of dementia, reduce the risk of your heart's blood vessels getting clogged, and even decrease the overall risk of death. The Mediterranean diet, named after the European Sea, is a magical eating plan that some of you might not know about. Countries like Italy are situated along it, and I'm referring to the diet practiced in these areas. It's more about fish than meat or dairy products. They consume things like salmon, as well as vegetables, fruits and nuts, and also beans, making sure to include legumes in their diet. When it comes to oil, instead of regular salad oil, they choose olive oil. There is data showing that following this kind of Mediterranean diet lowers the risk of dementia. And not only that, but there is even data suggesting that this Mediterranean diet also lowers the risk of certain cancers, such as breast cancer. It's really been getting a lot of attention lately. However, trying to eat more fish and beans is actually similar to the Japanese diet, isn't it? So it's really not something difficult to do. If you want to see the actual diet method, please click the official link in the description, then add us as a friend and send a message with Mediterranean diet in the chat. We would like to provide the Mediterranean diet method data exclusively to those people, so we look forward to your registration. We also share the latest medical information on our official LINE account. It's completely free, so please check it out. Other well-known preventive measures include quitting smoking and cutting back on alcohol. Also, controlling your blood sugar and blood pressure is important for preventing arteriosclerosis. One of the causes of dementia is called vascular dementia, which happens when small strokes accumulate due to arteriosclerosis in the brain. That's why managing things like blood pressure and blood sugar is really important. I've put together videos about blood pressure and diabetes here, so please check them out if you're interested. And as for other preventive methods, you might be surprised about periodontal disease. Actually, just having periodontal disease causes inflammation in the gums, and that inflammation is inflammatory in nature. These things called cytokines circulate through the bloodstream and affect the whole body. It's believed that this may increase the risk of dementia, so if you want to prevent dementia, you actually need to think about your dental health as well. And the thing I want to emphasize most for preventing dementia is what I mentioned at the beginning. It's about having conversations with other people. I have a question for all of you. There are people who go to exercise clubs but end up just talking with others without really exercising, and there are people who don't go to places where people gather, like exercise clubs, and instead work hard exercising alone in silence. Which group do you think has a higher risk of needing nursing care in the future? In fact, there is data showing that people who work hard exercising alone in silence have a higher risk of needing nursing care than those who go to clubs and just talk without exercising. Isn't that surprising? Exercise is important, but just as important, or maybe even more important, is interacting with other people and staying connected to society. Actually living alone and having little contact with other people. It's said that not having support from those around you increases the risk of developing dementia. On the other hand, staying connected to society, feeling a sense of purpose in life, having something that makes life worth living. There's data showing that people like this have a lower risk of dementia. In other words, people who are connected to society and feel their own role or sense of purpose in life are less likely to develop dementia. And it's said that this impact on lifespan is even greater than whether you smoke, drink alcohol, exercise regularly, or are overweight. While being mindful of lifestyle diseases and quitting smoking are crucial, it's equally important to consider if those around you feel a sense of purpose in their lives. This will become increasingly significant in the future. Now, in the next section, I'd like to talk about important ways of thinking about dementia going forward, as well as share my own thoughts. I've explained some things you can do to help prevent dementia. Of course, by putting these into practice, I think it's possible to prevent or at least delay the onset of dementia. I also want to keep these things in mind myself, but the reality is, by the age of 90, 60% of people develop dementia, and if you think about reaching 100, the possibility of developing dementia as you get older becomes almost inevitable for everyone. It's very high. No matter who you are, as you get older, you might eventually develop dementia, in other words. Instead of thinking that it's the end if you develop dementia, we should consider what to do if we develop dementia in the future. Even if you develop dementia, how can you continue to live in a way that's true to yourself? And if someone around you develops dementia, how can you support them so they can live their life in their own way? I think we need to consider these things. As I mentioned earlier, the things that help prevent dementia, like diet, exercise, and blood pressure, are all things that ultimately help extend your lifespan. And now, we live in an era where people are said to live for 100 years. In other words, it's important to prevent dementia, but please remember that it's also important to be prepared so that you'll be okay even if you do develop dementia. Thinking over and over, I must not get dementia, I must not get dementia, I must not get dementia, like this. If you push yourself too hard and try too hard, when you start to develop dementia, you might end up feeling hopeless and think, I'm no good anymore, like this. Society itself is making it difficult for people with dementia to live. If you develop dementia, it can't be helped, but even so, things may go well depending on how you handle it. It's crucial to think this way. Here's a perspective on disabilities to consider. When dementia develops and brain functions decline, cognitive abilities decrease, causing memory impairment, disorientation, and the inability to perform complex tasks. Those kinds of impairments appear, and then, as brain function declines, daily living issues will arise. For instance, shopping or traveling long distances may become challenging. When you can no longer cook, for example, preventing this decline in brain function is the goal of dietary methods to prevent dementia or, although the effect is slight, dementia medications. Trying to solve the root cause like this is what we call the medical model. On the other hand, trying to do something about the problems in daily life caused by brain function, approaching that is the idea behind the social model. If you think about it carefully, cognition. If a person's cognitive function declines, causing difficulties using self-checkout registers or automated ATMs, the challenges they face in daily life are not solely their fault, but also a result of the prevalence of these technologies and the lack of alternatives. Difficulties in daily life arise through interactions with society. In other words, if we can design society to be easier to live in even for people with dementia, it's possible that the difficulties they face in daily life can be reduced. For example, let's say someone develops a tumor in their bone, has to have one leg amputated, and now uses a wheelchair. If that person wants to go up to the second floor but there are only stairs and they can't get up, the medical model would try to solve this by providing a prosthetic leg and training them to walk. On the other hand, the social model would solve it by adding a ramp next to the stairs so that a wheelchair can go up. Providing an elevator is also a solution based on the social model. If there had been a ramp or an elevator from the beginning, that person wouldn't have faced any difficulties in daily life. As I keep saying, the disability is not the fault of the person themselves. It arises from the relationship with society. In other words, when someone develops dementia, they may get lost and become unable to go out, but instead of saying, you shouldn't leave the house, we should remember that even we get lost when we go somewhere unfamiliar. We get lost when we travel abroad, right? At times like that, we use things like smartphones or maps. We make full use of all kinds of things and rely on them to overcome obstacles to our actions. So, what can we do to help people with dementia not get lost? For example, making the bus timetable letters bigger or providing information through audio guidance. Nowadays, artificial intelligence robots might also be helpful. I think it's important to solve each of these issues one by one and create a society where it's easy to live even with dementia. And such a society, in other words, using simplified language is kind to people with dementia and easier for foreigners to understand. Since everyone gets lost sometimes, it would create a society where all can live more comfortably. This person has dementia, this person doesn't. Let's treat people with dementia differently. Let's put a global positioning system on people with dementia so they don't get lost. Creating a society where we separate and deal with people with dementia like this, is that their true desire? Whether someone has dementia or not, we should coexist and live together, allowing each person to live their life in their own way. We should strive to create a society that doesn't label people with dementia as dangerous or bad. Instead, we should first consider the individual for who they are, rather than defining them by their condition. What kind of life have they lived? What do they like? What are they not good at? And what gives their life meaning? People have diverse interests such as coloring, tinkering with fishing gear, knitting, and reading. People are diverse and each individual is unique. I think it's important to provide care that suits each individual and to support them in finding purpose in life. That kind of care is important. I've set up a community space called Hakodate Kurashi no Hokenshitsu, where healthcare professionals venture into the city to socialize over tea, coffee, and snacks. People are drawn in by the lively atmosphere, engage in friendly conversation, and then carry on with their day. Regular visitors started coming, and then those regulars began bringing their friends. As interactions with friends increased, those friends would share their worries with us. And as our relationships deepened, people would open up about painful experiences from their past, which helped lighten their hearts. Various positive changes have happened. There was also a husband who brought his wife with dementia to the space. We have even discussed together how we can provide care in this community health room so that people can live happily. It's called person-centered care, where the people around someone provide care with that person at the center. I think efforts like these, which focus on who that person is and what gives their life meaning, should be getting more attention. I may have been too passionate, but now in the 7th period, I want families of people with dementia and those involved in caregiving to know about this. Let me introduce some important points for dementia care. Here are 3 key points for dementia care. The first one is to value the why. For example, let's say someone with early symptoms of dementia keeps asking the same question. Hey, is breakfast ready yet? Then an hour later, hey, breakfast. And then another hour later, aren't you going to make breakfast? When you hear things like this, instead of getting angry and saying, I already made it, over and over, try to think differently. If they're asking about breakfast so many times, maybe they're a little hungry. If you can change your thinking like that, you could say, oh, you're hungry, aren't you? Well, I want to have some tea and snacks, so could you make some tea for me? You might be able to shift the conversation like that. Then, from their perspective, they'll think, oh, I get to eat some snacks. And maybe they'll feel a bit distracted by making tea. That's a possibility, in other words. People with dementia are not acting without any reason or understanding. Things like this. I try to call these challenging behaviors. When someone with dementia exhibits troubling behavior, they are trying to communicate something to us and challenging themselves to reach out. That's my perspective. When I was on duty as a doctor, a nurse from the ward told me, Mr. XX in room XX just won't sleep at all. In fact, he's wandering around the ward, and even when we try to bring him back to his room and get him to sleep, he gets angry. Doctor, please do something. When I rushed over, I found him indeed walking around the ward. The nurse probably called this wandering. If you just tell someone flat out to go back to their room and sleep, they might refuse. So why was he doing that? I think what's important is to have a conversation. When asked why he was walking around, Mr. XX replied, this is just normal. His previous job was as a building manager. In other words, for him, he wasn't actually walking around the hospital, but rather doing the job he used to do in the past. This kind of thing happens often. People with dementia sometimes live as if they are in the time when they shined the most. So when you ask them how old they are, even someone who is 70 might answer, I'm 35. Even if they forget the faces of their current family members, when they see old family photos, they might remember, this is my daughter. For them, it's not that they're wandering around the hospital, they're trying to accomplish the work they used to do. Realizing this, I thanked Mr. XX and said, today is your day off, so please return to your room and get some rest. He understood and went back to his room. Please try to have conversations and think about what reasons might be behind their actions. 3 key points for dementia care. The second point is that you don't have to forcefully correct them. This is to protect the caregiver's peace of mind. Humans aren't gods. It's impossible to never get frustrated, right? Interacting with dementia patients can be challenging, and it's normal to feel frustrated or sad despite your best efforts and patience. Tough moments are common in these situations. Sensei, I don't know if I can keep doing this caregiving anymore. How many years will this go on? Sometimes people ask me things like that. Like I said earlier, you don't have to say you already had breakfast. You can just say, oh, you haven't had breakfast yet? Well, let's have a snack then. And just go along with it, even if they've already eaten. That's one way to handle it. And sometimes there's what's called paranoid delusion, where they might say, you took my important wallet, didn't you? Even though you're always caring for them, it can hurt to be accused like that. But it's actually because they trust you the most and because you're the one who usually manages their wallet that they end up suspecting you. If you get angry and say, I didn't take it, it just turns into an endless argument. You don't have to force yourself to correct them. Even if you're being suspected, you can just say, oh, it's missing, is it? I understand that the wallet is missing right now. You think someone took the wallet. If you keep denying it and arguing against it, you'll only exhaust yourself in an endless fight. When you're in a situation where the wallet is missing, you should guide the conversation so that you're both facing the same direction, like saying, let's look for the wallet together. I think that's also a technique. And even if you find the wallet yourself, instead of saying, see, it was here, wasn't it? You should be a bit wiser. And even if you find it, suggest, why don't you check over there, Mom, and let her find it herself. Let the person find it themselves. By doing so, you can avoid being accused of things like, you knew where the wallet was all along, didn't you? You were hiding it, weren't you? There are techniques like this as well. If you have anything you're struggling with, please share it in the comments. 3 key points for dementia care. The third point is that with a little creativity, it's possible to maintain connections with society. People often discourage those with dementia, saying they'll get lost or make mistakes with money, repeatedly emphasizing the negatives. Mom, don't do that anymore. Mom, don't cook because it's dangerous. Don't use fire because it's dangerous. We tend to want to put these kinds of restrictions. I completely understand how you feel. However, reducing connections with society actually accelerates the decline in cognitive function, right? So instead of saying, don't go to new places, it's better to go together until they get used to the new place, or have a helper assist them. Using some kind of service, for example. Until the person gets used to it, it's important to build connections with society before dementia progresses. That actually becomes even more important. And sometimes the person themselves starts to feel it's a hassle and becomes reluctant. Sometimes they may not want to go out. For instance, if you're working and your mom attends day service, she might forget it's every Wednesday or not realize it's Wednesday. When day service staff arrives to pick her up, she might not be ready and refuse to go, saying she's not prepared. This happens increasingly often. How should we respond in such situations? Buy a small whiteboard at a dollar store and write, today is Wednesday, and it's day service. Just writing a simple note and leaving it there might help. Today is the day for day service, so they may remember, change and wait. It might work. Even just putting a big red mark on the calendar could solve the problem. Disabilities are shaped by the environment. Let's consider if adjusting the environment could improve things. Share any ideas or successful strategies in the comments. Your wallet might get stuffed with coins, or you might accidentally leave without paying and then feel like you can't go anywhere anymore. Let's say someone enjoys their daily routine of visiting the public bath, socializing, getting clean, and taking a walk before heading home. However, they occasionally face issues at the checkout. Recently, they started saying they don't go anymore because they don't feel confident. In such cases, if it's a familiar public bath, you could ask the owner to let you pay in advance, so you might be able to keep going without any problems. Public baths also have coupon tickets, right? So if you buy a bunch of tickets and give them to the person, telling them to use these for the bath, they might be able to keep going without any trouble. This is also a form of creativity. Instead, consider what you can do to stay connected with society. Why not think about what kind of ideas or approaches you can come up with? What do you think? These were the 3 key points of care. Let me share with you one more, the most fundamental and important way of thinking about care. That is to value emotions. People with dementia are not unable to remember everything. In fact, it is said that emotional stimuli tend to remain in the brain. So, if you get angry at a person with dementia for everything, even if they don't remember being scolded, the negative emotions, anger, anxiety, sadness, caused by being scolded, are imprinted on their brain. As a result, when that person comes again, they may recall those negative emotions and unintentionally take it out on others, get angry or become suspicious. If that happens, care will become more and more difficult. So caregivers must always keep in mind that the person's emotions remain in their heart. For example, if someone leaves the kettle on at night and the water keeps boiling, it could be dangerous if it causes a fire. If you say, "Why did you use the stove? You can't use hot water anymore, you forget everything," the person may not remember being told that, but still. The painful memory of their daughter's outburst lingers, fostering negative emotions and eventual resentment towards her. "I can do everything by myself." They might become rebellious like this, but instead when something dangerous happens, like leaving the kettle on, you could say, "Mom, I want you to live a long life. That's why I don't really want to say this, but please try not to use the stove. Thank you for everything." Try to communicate like that, then the mother will feel, "My daughter cares about me. Thank you." Those positive emotions will remain. That way, the next time you talk with your mother, care will go more smoothly. Please don't forget to try to leave positive emotions with the other person. And this issue with fire is very important, isn't it? If there's a fire, it would be terrible, but no matter how many times you scold them, they might forget being scolded. They might think, "I can cook, I can handle fire." In those cases, you should adjust the environment. For example, you can shut off the main gas valve so it can't be turned back on. But then, the person might think it's strange and start fiddling with the gas valve. A recommended method is to put up a big sign saying, "The stove is out of order, currently unusable." That way they'll understand it's broken and won't try to use it. So I think it's good to use environmental adjustments to help control their actions. How was it? This ended up being a really long video, but thank you for watching until the end. If you remember the contents of this video well, you'll be as knowledgeable about dementia as a medical professional. This time, we'll talk about what kind of illness dementia is, what the early symptoms are, and whether it's dementia. What methods are there to check for it? What are the treatments and prevention methods? And what is important? Creating a society that's more comfortable for people with dementia. It's important, and I have introduced perspectives on dementia care. Like this. YouTube Medical University offers doctor-approved advice to help you become healthier starting tomorrow. We deliver videos in a fun, easy to understand and responsible way. In this information society, everything medical information is now everywhere. Most of it is useful, but some of it is incorrect. To avoid regrets, ensure you get reliable information. If helpful, please subscribe to the channel. Please subscribe so you don't miss any new videos. I would really appreciate it. I have also posted other videos about dementia care in the past, so please check those out as well if you're interested. Well then, see you in the next video.